Paul.
Hello, thanks for appearing before the committee today. Just on schools, I've just got a couple of questions just from the exchange you had there. I've had a number of inquiries from teachers who have emailed me about the risks that they feel they have about their exposure to the virus. What would you say to them?
I think all of us, of course, and that's one of the reasons we have given the advice on the measures we have, want to try and reduce the transmission, and that's the social distancing measures. There will be groups of teachers and others who are particularly at risk potentially, and I know this is something that the CMO is looking at hard and thinking about the right advice for those people. I think for everyone in the public sector working, and those continuing to work in aspects of the private sector as well, clearly the more we're going out and about, we do all carry some risk of catching this. To go back though to the point that was raised earlier, for most people this is a mild illness, and we just need to remember that for the vast majority this is a mild illness. So I think advice around specific measures for vulnerable groups, those most at risk, is what NHS and DHSC are producing.
Yeah, and I've also noted that there's been some talk of advice given to those who are pregnant. What would you also say to those, and I declare an interest in the sense that my daughter is just 12 weeks old, but to mothers and carers for very, very young children, babies?
I don't want to dodge the question so much, saying that's really a question for the Chief Medical Officer.
Okay.
I mean, I know I'm a doctor, but
No,
I haven't practiced for a long time, and it's not, I don't want to be giving advice that's really the thing that the CMO and the NHS should be giving.
Okay, that's fair enough. Is the government engaging with those scientists that disagree with your plans?
Oh, completely. I mean, absolutely. If you think SAGE and the way SAGE works is a cosy consensus of agreeing scientists, you would be very mistaken. It is a lively, robust discussion with multiple inputs, and we don't try to try and get everybody saying exactly the same thing. The idea is to look at the evidence, come up with the answers as best we can. There are subgroups that work and feed into SAGE, and the membership of SAGE, I should say, changes depending on what we're discussing. So it's not as though it's the same group of people that always discuss all the topics. There are members that come for specific items.
And you made it clear that your role was to advise. How much do you believe that the current strategy that's being driven by scientific evidence, and how much by behavioural science, and how much perhaps by economic interest?
Oh, I think the advice that we've given from SAGE, which is based on modelling, virology, clinical, behavioural science, actually even other areas of science as well, that goes to the government, has been really carefully listened to, and has not been in any way, from our perspective, overlain with economic considerations as a reason to change the advice. Okay. So it's very straight advice. We're interested in two things. We're interested in saving lives and protecting the most vulnerable, and that's been the driving force that will continue in all of our outputs.
And just finally, other than what we've seen in terms of the regular conferences, I think daily conferences we're going to see from now on, what strategies are there in place to ensure effective information is given to the public and other organisations on the essentials of the plan? Yeah,
again, that's not really a science question in the sense that I can't, I'm not in charge of the communications of it, but
no, sure.
I do think it's critically important. I mean, it's very obvious that this is complicated, it's frightening. People don't know what to do sometimes, and therefore the clarity and the ability to keep repeating the same thing in a way that people can understand, I think, is crucially important. And all of the behavioural science would suggest that we've got to get the transparency right, we've got to get the communication right, we've got to trust that actually people want to know things, they want to know about this, and they want to be able to be empowered to make their own decisions on this. And I think those are some of the key things in terms of how we communicate this.